right, the next technique that we're gonna do is gonna really address the structural problems that happen with the back. What happens with our back tissue is that as everything starts to get tight and it starts to squeeze everything together, the muscles on the back literally start to slide off of the rib cage and come too far to the side. So what we're gonna do with this technique is we're gonna steamroll all of this tissue, all the muscle tissue, all the fascial tissue back to in the back where it's supposed to be, because it's called back tissue for a reason, not side tissue. So we're gonna have two versions of this. The first one is a little more simple and a little more easy, and then as your body gets used to being on the roller and you're not experiencing any kind of discomfort, we can move to the little bit more advanced version. So this first technique, you guys are just gonna roll over. You're gonna get off of center of the roller just a little bit. You're gonna bring your arm over. That's good. That's going to give you a little bit of balance. And again, you can see how Mary Kate here and Christoph are using their feet to find balance on the roller. And then very slowly, because slow is always key, they're just going to inch their way back to the middle. And this is important. The slow is what changes the fascial tissue. It's what repositions all of these fibers so they're where they need to be. Another thing that I really want you guys to pay attention to is, go ahead and do that technique again, is as they come over to the side, you can position yourself, you can move into that position kind of quickly. You don't have to go slow, but once we're doing the actual technique, which is taking the tissue from the sides to the back, that's where we need to go slow. And the other thing is we want to make sure that the head is relaxed on the roller, because what happens is if Mary Kate or Christoph lift their heads up, that tightens everything in their trunk and their torso, and all that back tissue is now really tight, and we're not gonna get as much change. So they're gonna make sure that their head is relaxed on the roller, and then they're gonna use their hand out to the side, and that the feet have a nice width to them, and that's gonna help them be as relaxed as possible as they roll back to the middle. They're gonna do that a third time. And then nice and easy, rolling back to the middle. Now you can see Christoph and Mary Kate are finishing at a little bit different times, and that's because the difference between a male and a female is that a male has a wider back. And so it's gonna take him a little bit longer to move that real estate, where Mary Kate's back is a little more narrow, so she's finishing a little quicker, but she's still going slow. So guys, let's go ahead and do the other side, because we always make sure we work both sides equally. Because if you only focus on one side, even if that's your painful side, you're gonna find that you're creating a structural imbalance because we're not lengthening things to be nice and symmetrical. So same thing, they position themselves, they get into position, and then nice and easy, they inch their way back from the side, back to the middle. All right, the more advanced version of this. Now, if you're not having a lot of back pain and you have a little bit more balance and flexibility, we're gonna take this range of motion a little bit further. So now we're gonna go back to the right side. So now we're gonna go to our little bit more advanced version. So now what you guys are gonna do is you're gonna get positioned all the way over on your sides. And again, this is where time on the roller comes into play. It takes just a little bit of practice. So Mary Kate and Christoph are gonna get into position. So now you can see they're all the way over on their side. They actually have the pressure all the way on their hip and all the way on their shoulder. The head can come up a little bit because of the width of the shoulders. It's not gonna be able to lay all the way down on the roller for the first part of it. And then nice and easy, they're gonna inch their way back to the middle. So again, we're steamrolling lift in our spine that's going to allow us to have better posture. But when that tissue gets pulled laterally, it's going to squish and bring everything down. So again, repositioning. Okay, wait just a second. Okay, nice and easy, go ahead. And you're also going to find that if you're left or right-handed, one way on the roller is going to be a little bit more easy in the beginning, just because we're typically left or right side dominant, and that's okay. Consistency comes into play, and the more consistent you are on the roller, you're going to find things start to equal out, and you're going to be a pro. All right, ladies and gentlemen, here we are in our clinic. And remember how in the other techniques we were talking about, we always have variations for everything that we did on the ground. You know, let's say you just had some back issues, it's difficult to get up and down. Let's say you're a little bit older, it's difficult to get up and down on the ground, or it's difficult to get yourself on the roller. Well, we've come up with some amazing variations that you're going to be able to do those exact same techniques in a very easy to do format for your body without having to have the stress of getting on the ground if your body's not ready for that. So this first technique that we're going to go to is going to be the back technique or the erector work on the wall. So after we've warmed up, the body's moving, you can use the warm up from the beginning part of the video. And all you're going to do is you're going to take your 36-inch roller. At home, you're going to make sure you find a spot on the wall where there's maybe not stuff or pictures that you have to worry about. Make sure that the wall is sturdy enough that you're not going to put a hole through a real thin sheetrock or anything like that. You're going to take your roller, you're going to put it right on the wall. Nice and easy. I'm just going to position myself onto the roller. Now, because I'm standing up, I'm not going to have as much pressure onto the roller as I would if I were laying on the ground. So you might not feel like it would be the same thing. Again, remember that that is okay, and just because it's not sore or tender and for sure not painful while you're working, that doesn't mean you're not going to get any less benefit. So what we're going to do is we're going to get that roller, making sure that it would cover from my head all the way down to my tailbone. I'm not going to focus on trying to put my head back because that actually puts a little bit of strain in my body in this position, the way that the back is curved when I'm trying to push on against the wall. So my head is just going to be nice and relaxed. What I'm going to do is nice and easy. I'm going to shift and I'm going to roll my tube on a tube into the start position here. Nice and relaxed. I'm going to put a little bit of pressure into my feet and lean against the roller as I roll back to the middle. And again, we're making sure that we're steamrolling everything that goes too wide back to the middle. So again, I reposition. I can go a little faster for that technique to get started. Nice and easy, nice and relaxed. And the great thing about this is that anybody can do this. Your age, your shape, your size, none of that matters. Get set to the side, nice and easy. I roll my way back to the middle. Okay, then we would just switch the same thing to the other side. Nice and easy, I get to my side and I roll. My arms are nice and relaxed. I can keep them up if I want, whatever feels more comfortable. Just making sure you're not straining real hard. And again, we're not fast-paced rocking. We're getting set to the start position. I lean against the roller, nice and easy. I rotate my body back to the middle. That's going to be the technique for working the back.